Hey, it's Dr. Birchler from ChiroHealth Spine Disc Center. We deal with a lot of patients with various disc problems here, disc herniations, disc bulges, degenerative disc problems, and in particular, disc herniations. I wanted to address a topic that's a very, very common thing. And as is the case with many things, what I would recommend, and from a natural health standpoint and true kind of healing standpoint for a disc, is commonly much different than you hear in the general medical realm, and certainly from folks who are not spine care specialists. So what I want to talk about is injections today, and many people, when they have issues, they'll end up getting steroid injections, epidural injections, these kind of things, and I get it. They the idea is that you're going to help inflammation or pain or these kind of things, but I wanted to really go over basically why I don't recommend that virtually ever, and how that's actually a negative thing. It's actually not only is it not helpful, it's a negative thing, a negative consequence to doing that. But I want those of you dealing with to have an understanding of that, so you have a little bit of information in the mind to understand when you're hearing this kind of thing a lot, potentially from various people or practitioners, of what another angle and a more accurate angle is on that. So just real quick in a picture, this picture represents a disc, and the jelly has kind of blown out of the donut. So this is inside the body, right? It's a living body. It's not a machine. And how would the body actually deal with that? Well, this shouldn't be there. And in the body's own strange and mysterious ways, it senses that, and it's going to use the immune system to actually break that down and dissolve it. So if you have a building crash down, there's a bunch of stuff there, shouldn't be there, and you have to bring garbage trucks in, and guys are going to have to come out and do stuff and carry it away. Body's got to do that with a disc that's herniated out or broken off, but it does that through cells. Those are like the garbage trucks, and those cells are actually part of the immune system, so they're basically going to do things to dissolve it, break it down. That's going to take time, and that process is dependent on inflammation. So that inflammation has to happen to actually get it to truly get better and go away. So you take these injections or these or pills or whatever for these steroid kind of things. They're anti-inflammatories, and it may be powerful for pain. They often are. Sometimes it's like a dud. They don't even do anything for pain. But regardless, it's not about pain. It's about healing. It is actually blocking the cellular response in nature's own wisdom that will actually repair it and make it better. So in the long run, it is a negative. In the intermediate run, it's a negative. In the short run, it may or may not make pain go away, but it actually blocks the process that needs to repair the disc. Right? So that's kind of a summary of the message here. Okay. Now let me show you a couple things here. This is just a paper showing the actual known mechanisms that when you have a disc and the disc tears, the disc herniates, what's actually happening in terms of the immune cells, the white blood cells that come in there. They put chemicals down, enzymes, they dissolve stuff, right, and break it up. So it essentially treats a disc herniation kind of like an infection. Here's part of the disc that should be inside there. It should never be out of there, and when it gets out, no good. The body looks at that as a foreign thing and wants to break it down and dissolve it. And so it's an immune-mediated process. So when you take these injections, these oral steroids, it is short-circuiting your immune system and the chemical process that coordinates that. And I have for sure, in my clinical experience, outside of even any published research, whatever, people who take the steroids have more chance of residual weakness and foot drop and strength not returning when they're dealing with these disc problems there. And man, that stinks when you're already going through a tough time, and then instead of it going through that and getting pretty good, you now have weakness for a long time or forever. And if we could avoid that, avoid blocking the body's reparative process and let it do its thing, and getting that pressure off there, it can probably happen fast enough that strength will come back, versus physically that thing doesn't dissolve because you chemically blocked it, and now you have pressure on the nerve for a long period of time, and the longer you got pressure on the nerve, the more the nerve is likely to die, diminish, not come back, and those are tough when they, when it's been had physical pressure on there for months or years without the body having been allowed to get that pressure off by dissolving or resorbing the herniation. This is a research study from 2013, a review of ligament injuries, and what we're talking about discs in the back, but the disc in the back is technically a ligament. It's a fibrocartilaginous ligament. That's what it is. So 100% applicable to the discussion. And of course, it's a very long article, and they're going through all kinds of different research studies and the known anatomy of ligaments, and what happens with them, and when they're injured, what happens, and how they repair, and do they repair to normal? The answer is basically no, but they heal through this kind of inflammatory and then scar tissue mechanism. And so when you have a disc where the jelly blows out of the donut, it's like imagine there's this fibrous part of the disc, and it rips through there. So there's like a hole in the disc. Think of like a bike tire or something like that. It gets a hole in it, air comes out. Disc gets a hole in it, jelly comes out. So the body's going to dissolve the jelly, and that happens through what we just talked about, the immune system, and over time, and all that kind of stuff. But then even once that's dissolved, okay, now the disc has a hole in it. That's no good. So what happens with that? The body brings these cells called fibroblasts. They're basically the cells that make scar tissue. So if something's hurt, it's like you got to plug the hole. So just like with a bike tire, you'd have to put some goop in there and let it kind of seal the hole. The body's got to put scar tissue and kind of seal up that area. Just like if you tore a ligament in your knee or ankle or something like that, body's going to deal with that. It's going to put scar tissue there, kind of mend the ligament. It's probably not going to be quite as flexible and whatnot as it was before, but like the body does, pretty darn good job, and life will go on. But it takes time to do that. It's you're talking weeks to months, not days to a couple weeks. It's weeks to months and months for a more total reparative process. So same thing needs to happen there in the disc. And so what they say here, right in the abstract of the study, is that a shift away from the use of steroid injections and non-steroidal anti-inflammatory medications, although these compounds have been shown to be effective in decreasing inflammation. Now, what does effective mean? It means inflammatory markers go down. That doesn't mean it effectively made the patient better. It means that there are certain inflammatory markers go down, but inflammation is not bad. When you get injured, that is the normal response to injury. Your body has to have inflammation to heal. So this idea that inflammation is bad, well, not really. It's a normal, natural process, and it is an appropriate time for inflammation when there's injury, and it coordinates healing, and then as healing subsides, the inflammation subsides. That's the way nature is, okay? So although it's been shown to be effective in decreasing inflammation and the pain of ligament injuries for up to 6 to 8 weeks, their use has been shown to inhibit the histological, the biochemical properties of ligament healing. For this reason, their use is cautioned against in people who have ligament injuries. Such products are no longer recommended for chronic soft tissue injuries, acute ligament injuries, except for the shortest possible time, if at all. And that's my message to people too, has been for a long time, is that the best is not at all. You never do it, ever. No pills, no injections, none of that. You respect that the body's been injured and it needs to heal. It doesn't need you to say, well, I want to do stuff, so I'm going to take some medicine and try to go do stuff. No, your body needs to heal, and it will tell you when you can get back to doing stuff. So it's not about pain, it's about healing. Pain is the body's message to tell you, hey, you can't do this right now. I need to heal further. And naturally, as things repair that activity, and those things will go back. So that is a long-winded way to kind of explain some of the background of why, if you hear me say, look, I don't recommend to do the injections. I don't care what anybody else says. I don't care how many letters they have behind their name, what type of doctor they are. I don't recommend it. Okay, and there's very good reason for that. You're going to do better in the long run in virtually every single case by not doing any of that and just letting the body do its healing thing, and you just work with the whatever needs to happen mechanically, whether non-surgically or surgically sometimes, to get things the structure back together, or get the pressure off with what we do here with disc type of problems. But don't go into the world of the injections and the steroids and all those kind of things. It's going to be a long-term negative. Okay. If you have a question about your particular case, you can ask me. But this is basically the message, the detailed version of the message of the answer I'm going to give you if you're asking a similar question to that in most cases.